Welcome to Meet the Author. I'm Bridget, the project manager of Arthroplasty Society in Asia. Interviews with authors and the latest clinical research and professional perspectives features in Meet the Author program. Today I'm joined by Dr. Sun Bin Han, who is the Chief Surgeon of the Department of Orthopaedics Surgery, Korea University Annan Hospital. Dr. Han is also a member of Asia Faculty and Arthroplasty Editorial Board. In this episode, he's going to share with us his insight of patient blood management during total knee arthroplasty. Welcome, Dr. Han.
Thank you, Bridget. I'm very pleased to be here. Thank you for giving me an opportunity to talk about my recent study.
Great to have you, Dr. Han, as a faculty member of Asia and a frequent guest. Could you please share with us how you are involved in this society?
I remember the very beginning of this society. It started as a China-Korea arthroplasty meeting. I have attended first China-Korea arthroplasty meeting in Beijing in 2013 as a podium presenter. And I felt that meeting is very interesting and valuable in terms of academic communication and education for young surgeons in Asian countries. And fortunately, I had a chance to invite Asia 2019 meeting in Seoul as a Secretary General.
Thank you, Dr. Han. Your presence at Asia surely means a great deal for this society. Since you have had so much collaborations with Asia, I wonder that, as an insider, what attracts you to join this editorial board? And what advantages do you think arthroplasty have?
Being an editorial board member of a peer-reviewed journal is a great honor and a privilege for every scholar in academic position, especially such a great journal like Arthroplasty. I believe there is a strong need for arthroplasty journal for Asian surgeon and Asian population.
We will take as some compliment. I was told to pass the message to you that arthroplasty has been included in ESCI and the SCUBAs this year.
Congratulations.
Well, thank you again for being a supporter and witness for Asia and arthroplasty growing bigger and more dynamic. Thanks for sharing your marvelous experience with Asia. Now let's move to your study. You described the patient blood management in TKA. So why do you think patient blood management is so important for TKA patients?
Thank you for the very important question. Patient blood management is a philosophy which cares patient own blood as a precious resources to improve the clinical outcome of the patient. But in real world, including my country, South Korea, not many doctors are aware of the risk of allogenic transfusion, which causes many adverse outcomes for arthroplasty patients, such as PJI, pneumonia, and multi-organ damage.
Dr. Han, in this paper, you talked about patient blood management undergoing total knee arthroplasty and effects of injection of veins, iron monotherapy, and you mentioned that patient with iron deficient anemia in specific. Could you please share with us the hazards of preoperative anemia?
It is well known that the preoperative IDA is directly related to postoperative mortality and many other complications. But still, many arthroplasty surgeons are ignoring this problem, which is very easy to correct with careful preoperative evaluation and patient optimization.
It's great to mention these issues here, particularly worth mentioning here. In your conclusion, IV iron monotherapy was shown to be insufficient in successfully treating preoperative iron deficiency anemia. What other therapy do you think is effective for dealing with IDA? Do you use erythropoiesis stimulating agent to improve anemia?
Even though my study was industry grant funded one, the conclusion was negative. effectiveness of blood management using IV ion therapy for total arthroplasty patients are very controversial issue. If you search the journal with this topic, you can find both positive and negative conclusions. Recently, on JOA, Journal of Arthroplasty, my Korean colleague, Dr. Jongbom Jang, published his data. His conclusion was the IV ion does not reduce the amount of allogenic transfusion for bilateral total arthroplasty patient. But you can also easily find many articles which concluded IV ion therapy is very effective. I think we need more study on this topic with more large scale and subgroup analysis as well. I don't use erythropoietin or erythropoietic agent routinely, but for the patient with impaired renal function, I recommend erythropoietin or erythropoiesis stimulating agent.
After all these perspectives with patient blood management, could you please describe the blood management protocol for TKA patients with IDA?
The preoperative correction of iron deficiency anemia is my principle. Hematologist consultation to find out cause of anemia and its correction according to the cause is basic strategies.
Then what's your opinion about preoperative erythropoietin combining with preoperative autologous donation, the PAD, in preoperative blood management for total arthroplasty patients with IDA?
That might be a good option, but still, we need further study on this issue. In my institution, if patient want, we perform PAD. PAD program is possible because we have specialized personnel and department handling blood management issue.
It's good to know that. What do you think the result of this study will provide guidance and implications for the clinical practice?
IV ion monotherapy is ineffective. I can say we need more study and more evidence to justify the routine use of IV ion to reduce the postoperative allogenic blood transfusion for TKA patient. This is my suggestion.
Thank you for your suggestions. Regarding this topic, could you please just summarize the future research directions and possibly clinical significance in preoperative blood management for TKA patients?
We have still not enough evidence regarding blood management issue for total arthroplasty patient. There are lots of subjects about PBM which need to be clarified. This includes preoperative, intraoperative, and postoperative strategy of PBM. For example, recently I published an article about bone wax use to reduce the blood loss after total arthroplasty.
Thank you, Dr. Han. You share a lot of information and the clinical perspectives regarding preoperative blood management for TKA patients. We know that you are engaged in orthopedics for nearly 30 years. I wonder what's your original intention, or I would say aspiration. What inspired you to pursue a career in orthopedics?
At the time, when I chose the orthopedics as my career, I was fascinated by fracture repair surgery and bone healing mechanism. And I was also interested in biomechanics, which is very important for orthopedics.
We really appreciate you for sharing with us those valuable insights. In your study, I noticed that your research received grant support from JW Pharmaceuticals. Research topic selection seems to be very important, very significant issues, at least for the first step to have a successful funding application. Could you share with us your experience in funding application?
For this study, JW Pharmaceutical Company contacted me first. They wanted evidence to justify IV ion therapy for preoperative anemic TKA patients. If you have good research team, including clinical research coordinator and high quality published studies and willingness to the study, at least in my country, there are many chances of research grant from not only industry, but also government organizations.
Finally, let's move to the last but very significant question. Can you give some suggestions to Asia and arthroplasty?
Yeah, that is a tough question. Recently, there are too many new academic societies and journals are appearing all over the world and disappearing. However, I think Asia and arthroplasty have been showing a very good start despite the COVID pandemic situation. I think it is because of strong leadership and enthusiasm of many members. I would like to congratulate on that. For Asia and arthroplasty, my suggestion is to be a productive society and journal, we need three things basically. The first is philosophy, vision, and mission we are sharing with is most important. And second, agenda for future development to accomplish our vision and mission is needed. And third, the organization and enthusiastic members to support our agenda. Not only senior experienced one, but also young and very active surgeons. I'd like to suggest more engagement of young active surgeons of many Asian countries to the Asia and arthroplasty. For example, involving them to the research committee or educational committee or community development committee, etc.
We are very honored, and hopefully young surgeons wouldn't miss the chance to listen to you, and they could definitely benefit from it. And to help and educate young surgeons has always been Asia's mission. Experts in Asia like you surely help it fulfill its mission more easily. To launch our official journal, Arthroplasty, is another way to promote educational and academic communication. Thank you, Dr. Han, for sharing your powerful perspectives and wonderful insights about these clinical significant issues. Your research work and your personal experience would definitely inspire our audience a lot. Thank you so much for that.
Thank you again for giving me a great opportunity to share my humble study and idea with you and many colleagues in Asian countries. Thank you.
Thank you again for your presence, Dr. Han, and thank you, our audience, for staying with us. That's what we have for this episode of Meet the Author. Thanks for watching.